Morning, everybody. So my name is Junette. Again, I'm a family nurse practitioner that's specializing in wound care and podiatry. I'm so excited to take over today, and I can't wait for you guys to see what I do for the day. I'm not a coffee person, and if you are too, you need to try the Trader Joe's matcha green tea latte mix. You guys, it is so good. So kind of a quick background, the wound care that I do is pretty much like home health. I actually go to either the patient's houses or facilities, senior living facilities, all those stuff, and I would see the patient's wounds or do their podiatry. So before I go there, I usually check my patient list to make sure that they're all in my route for today, that they're all confirmed and all those good stuff. So I was watching House of Dragons last night, and this scene came on. So, I'm a family nurse practitioner specializing in wound care and podiatry, and this one is. Hi guys, so I have 5 patients in this facility, so it's gonna take me a while. So while I'm there, I'm gonna leave a question box here, and feel free to ask me questions, and I'm gonna answer them later. Okay guys, it is now 12:41 and I'm done seeing patients for today, and I'm just gonna go home now and chart. But podiatry patients are really easy to chart, so I'll be done very quick. Okay, so I'm going to answer a couple questions. Again, I'm going to put a question box here in case you have any other follow-up questions. How did you get started in wound care? So for this, I was actually a registered nurse working in psych. Yes, my first job was a psych nurse, which was also a really cool job. There was a family nurse practitioner over there that was treating, and like, I don't know why it just cuts off after 15 seconds, but I actually was watching her do it, and I was like, this is interesting, because I didn't know that FNPs can also do wounds. And then after that, I started looking for jobs as a wound care nurse, but sadly I never got hired for one. And that it just so happens that, after later on I became a family nurse practitioner, and then I was just looking for jobs in Indeed, and I knew from the beginning that I've always wanted to try it out, so I finally did. I got hired in this amazing company, and now I love my specialty. What's your schedule like? Do you ever have to take work home? So you guys are not gonna believe this, but as a full-time clinician working in wound care and podiatry, I work 3 days a week, about 15 hours. And do I ever take work home? No, not really. I mean, the last thing I do at home is really charting, but my charting takes like 20-30 minutes, so I don't really consider that as like really taking home your work. I've been thinking about getting my NP, but specifically in podiatry. How do you get into this specialty? Advice. So again, it depends on the company that you work for. It just so happens that my company is actually owned by a podiatrist and an MD. So that's why I also do podiatry. It's not like those, like when you go to the OR and you do drills, all that stuff. It's not like that. We're basically looking at the feet, looking at the nails. We are looking at like venous stasis ulcers and arterial, and that's what we do as podiatry specialists. Is this something that can be done independently as a provider? So it depends on what state you are in. Currently in California, but we're all waiting for the AB 890 where we can practice independently. So in other states, as an NP, you can actually practice. And practice meaning you can open up your own clinic and it's all you. So if you're ever interested in that, there's a lot of states out there that you can practice independently and you don't need to be under a physician. Where did I start in my nursing career? So I actually graduated with my bachelor's degree in nursing in the Philippines, you guys. Yep, you got that right. I saved a lot of money because of that.
3 things you need to know.
And after I graduated, I did psych, I did labor and delivery, postpartum, I was a floater, and then I became a clinical instructor for OB and peds as well as med surg. So that is my experience in nursing. And then I became an NP. How can you become a wound NP as a new grad? I'm not quite understanding this question, but I think what you mean is, how do you specialize in wound care as a new grad NP? And if that is your question, then let me try to answer it. Really, all you really have to do is apply and apply and apply. It's different if you are looking to get higher. Like, for example, if I have my FNP and I'm going into psychiatric mental health NP jobs, the chances of me getting hired is very low. But for wound care, there's no specific like core for it. Like, there's no specific boards for wound care alone. You can only get like certificates. So what I did is just, you applied in a company that I thought was amazing, and I was just so lucky that they actually train people at least 2 weeks, and if you need more, then they train you some more. So that's something that you guys need to look for in companies that are trying to hire NPs, and don't get lowballed with your salary. How do you get started in wound care? Apply, and go to conferences or try to shadow someone that already works in wound care. And also, here is an interview tip. Okay, when they're gonna ask you, do you have experience in wound care? They don't mean exactly like you are working in a wound care clinic, a wound care center. But for example, if you work in the ER, yes, you deal with wounds. You're gonna count that. If you work in labor and delivery and postpartum, yes, you deal with wounds. There's C-section moms, there's all those stuff. Yes, you have experience in wounds. If you work in med surg, yes, you have experience in wounds. So, count those. Those count for wound care experience. Thanks so much for tuning in today, you guys. It's time for me to go night-night. If you want more wound care content and podiatry content, I'm making a series right now where I talk about the wounds in House of Dragons. So definitely follow me at VanDNP. Thanks!